Authorities in Rukiga district, southwestern Uganda, expressed concerns over inadequate funding and staffing, citing their impact on poor service delivery. This revelation came during the Local Government Finance Commission outreach program aimed at assessing funding for upgraded health centers and primary schools in the Kigezi sub-region. Mariam Nalobega Patience, the vice chairperson of the Local Government Finance Commission, spoke to reporters at Kahama Health Center 3 yesterday, highlighting challenges faced by local governments in health education and service delivery. She pledged to present these concerns to the Commission.
We are here under our mandate of advising the President on funding for local governments in areas of health, education and general service deliveries. So we are in this region of Kigezi. We've been in Rwanda, we are in Kabale, now we are in Rukiga, to see how service delivery is being done by local governments and also to identify the challenges the local governments are facing when they're delivering services to the communities. Well, our area of interest today has been health sector and education. We're going to a number of schools and health centers. Right now we are in this health center of Kahama, but we have identified it as a hard-to-reach health center, but also lacking some facilities. For example, they don't have electricity, relying on solar, and also the weather changes and sometimes they can't even be powered by solar. They don't also have enough staff accommodation. The staffing levels are still low, but there is hope that they are going to recruit a few in this financial year. Also, another challenge we have identified in this health center, I think, is the issue of the inpatients. They lack where to cook their meals because now they deliver mothers who need to eat on time to support their newborn babies, but you find they have nowhere to cook. So we are going to advocate together with the district to see that this health center is more funded.
Rukiga District Deputy Kao, Mrs. Bilingelo Rita, criticized insufficient central government conditional grants, citing inadequate funding for road maintenance. Rukiga District has 170.1 kilometers of roads requiring Ugandan shillings 340 million, but receives only 152 million Ugandan shillings.
The autonomy for local governments is limited. We don't have full control on the funds that are allocated to us, mainly because the biggest percentage is conditional grants. Locally raised revenue is only 2% of the entire district budget. Whereas the Ministry of Finance uses the grant allocation formula to allocate resources to the local governments, we have seen that some local governments continue to receive additional funding in form of transitional grants ad hoc, and this results in two imbalances in service delivery. There are some local governments year in, year out, they have transitional ad hoc funding. But for us here in Rukiga, we don't get these funds. And yet, the population expects the level of service delivery to be the same. Especially these neighboring districts. They keep listening. What is happening in our neighboring districts are Kabale, Rwanda, Tungamo. So we always have our ear on the ground. We want to know what is happening in the neighboring districts, and we keep getting feelers that they are doing better than us in terms of funding. Central government conditional grants have continuously been inadequate. We are giving an example of the Uganda Road Fund. It is not commensurate to the road network in the district. We have a total road length of 170.1 kilometers. This would require about 340 million, going by Ministry of Works standard rate of 2 million per kilometer, but we only receive 152 million under the road fund for, and looking at the difficult terrain, of course, it makes it very difficult for us to keep our roads in good motorable conditions. The condition of roads don't put into consideration the nature of our district. Rukiga is remote, has difficult terrain, and is hard to reach. And this makes the unit cost of service delivery in Rukiga very, very high. If I can give an example of fuel. For us to get fuel, we need fuel to drive to Kabale to get fuel. And come back here and then start delivering services. So our unit cost for service delivery is just too high because of that. It has affected service delivery in the following ways. We have infrastructure deficit in schools and health facilities. We have very many unfunded priorities. And we have the roads that we make, they have a short lifespan because of the hilly terrain. The fiscal decentralization architecture put in place by government has adequately addressed the financial needs of local government due to time business, especially for the local revenues. However, supplementary budgets which are issued towards end of financial year, they complicate project implementation progress, and sometimes we have to return these funds to central government.
Gilbert Ahumuza, the acting district health officer, lamented the lack of a district hospital, understaffing, and unfinished projects due to limited funding.
So they assumed that with time, electricity will reach here. But of course, which I don't know when. So, only that they provide very many tanks. We have very many tanks that can really have water. But assuming maybe they develop space for long, I don't know whether it will serve. And maybe if we get more women delivering from here, that means we have to use a lot of water, So meaning that the tanks may not be also enough with the time. So we just, on the mercy of God, having the rain so far. Yes. Because there is not, we tried as a district actually, we had a project of also making our own pump, our own borehole, but we failed. These people were lucky to get water just behind here, but for the district when we tried to see if we can get the boreholes around, we failed, and we had to again relocate it down where we left the vehicle. That's now where the district has decided to have the borehole.
That's where people hear your face.
We have two health center force that are giving services, various services, ranging from cesarean section to medical education and other services, health education, immunization. Several of them will receive medicines, as other districts do receive. We have, though they may not be enough in some areas. As a district, we don't have an hospital, so we depend on Kabale Regional Referral Hospital to refer. In case of an emergency, the distance may not really favor us if it is an emergency. In these facilities of ours, the number of staff not enough, because we don't have enough wage to recruit more staff as per the current staffing structure. However, we are generally trying to give services as we can. As a district, we really feel that we should have a district hospital or community hospital at Rukiga, because when you look at some of the facilities, take an example, Kahama, which is far from the center for. Most times, if we are to refer from Kahama, maybe to Kabale Regional Referral Hospital, if the case cannot be managed within a district, really it is a challenge. We have only one ambulance. Sometimes this ambulance maybe has taken a referral somewhere, so you find people are suffering. If we had the hospital, it would be probably, like, for example, be encouraging mothers who are expecting deliveries and have some challenges, they go and camp at our own hospital in order to avoid probably challenges of maternal mortality, maybe the infant mortality. And we are lucky that as a district we haven't got challenges of maternal mortality. We are trying, our health workers, want to thank them for the services they do offer. The Kahama Health Center 3, it is really nice when you look at it. It has almost most of the facilities. It is equipped, but the number of staff are not yet enough. But the good chance is that the government gave us 164 million, so we are going to recruit a few of them. It is not enough for all the staff to be there, but at least we shall be able to get like a senior clinical officer, laboratory technician, health information assistant, so as to functionalize it well. We have some staff there that we picked from other facilities so that it starts operating.
Tudiaguma Pamela, the in charge of Kahama Health Center 3 in Chikomero Village, Bulime Parish, Ramchuchu Sub-County, expressed concerns over lack of electricity, reliance on solar power, understaffing, and inadequate accommodation.
And the kitchen, even we don't have electricity here, because these people who are constructing here, they provided a borehole, but which has already refused to pump. The solars cannot pump this water from down to maintain it. So we had to improvise we improvise it. So there is no water in Yes, we have expressed that challenge, because even these mothers, they fear to come here because of the roads. Sometimes they say, if I come and it gets night and I'm referred, how will I go? Because there is no means of transport. Even if you get a car, you have to call in Mahanga. And how much will they charge? Will this mother manage to get this? You have a challenge here. So these mothers, they say, let me run to Mbaro where there is theater, where there is everything. Instead of suffering in Kahama, and when it reaches night, they transfer me. So that is also a challenge.
Sure. Produce is not easy.
It is not easy. Though we are delivering some, but more of them.
In general, in the area now, those are worries. Huh?
Yes. But less deliveries. But during ANC, that's when they come. So we give them a health store. In case, when these days reaches, you come. So they come, they wait, so such that we get the time, early time for the farm. So they are not delivering from home.
Okay.
They are coming here. We also have lab, which is working, and inpatient.
This electricity is from when?
Solar. And when it reaches like these winter seasons, it shuts off.
The sunshine.
It shuts during like at night. We didn't have light. When it is not sunny season.
Is they charging the batteries also?
Do you also do immunizations here?
Yes,
You have a fridge?
we have a fridge.
So if the solar goes off, what happens to the fridge?
No, the fridge was provided by its solar. Yeah, it is independent. That is the good thing we have. But we will be suffering.
Okay.
The fridge.
The fridge can't go off. It can't.
So you said you have no staff accommodation?
Staff accommodation we have.
You have? So I was worried if somebody came in the night.
Staff accommodation at least we have.
So you're not saying, somewhere people say because it's not enough.
For
Although they are not enough, but
new facility they were given priority.
we are given 2 twin houses, but still we are staying 2. Which I can't say it is enough, because me with my husband, I'm not supposed to sleep with another. Yes. Now if my husband comes, what will the other staff do?
That one can take the walk.
It is not enough.
And you are bringing more stuff.
And they are bringing more stuff, yet we are staying 2. A woman with a woman, a man with a man, 2 porters are staying with an askari, there are 3. So we share.
Other attendees included the Local Government Finance Commission members Sumbuwa Naima, Adam Babale, Emetu Michael Emodu, Priscilla Asimile, James Menya, and Rukiga District Political and Technical Staff. Memory Aguma for iTelevision.